Hey everyone, today we are talking about lenograstim. Lenograstim is a recombinant glycosylated human granulocyte colony stimulating factor that primarily regulates the formation and function of neutrophils. It is used to shorten the duration of neutropenia and lower the risk of infection in patients receiving cytotoxic chemotherapy or a bone marrow transplant. After myelosuppressive therapy, lenograstim also helps to mobilize peripheral blood progenitor cells for hematopoietic recovery. It is intended to improve neutrophil recovery, which will lower hospital stays and the requirement for antimicrobial therapies. So there are two primary methods to deliver this medication. One is IV, which means delivered directly into the bloodstream, and subcutaneously, where it's injected just under the skin. Lenograstim is absorbed gradually over a few hours when administered SC. What's interesting is that the peak blood concentration of lenograstim increases proportionally with the dose, meaning higher doses lead to higher concentration in the blood. Lenograstim doesn't accumulate in body even when given repeatedly. Once in the bloodstream, lenograstim doesn't wander far. It has a relatively small volume of distribution, about 52 milliliters per kilogram of body weight. This means it stays mainly in the blood and does not spread widely throughout the body tissue. Metabolism: the primary process by which lenograstim breaks down into smaller peptides after entering the body is metabolism. The procedure makes sure that the medication is thoroughly digested and that less than 1% of it is eliminated in its unchanged form of urine. This demonstrates how well the body processes the medicine. Depending on how it is administered, lenograstim elimination half-life, the rate at which it leaves the body varies. The half-life of subcutaneous injection is 2.3 to 3.3 hours. It is less time-consuming for IV, taking between 0.8 and 2.1 hours. Because of this relatively short half-life, frequent dosing is necessary to maintain its effect. Lenograstim mechanism of action: a synthetic form of the naturally occurring protein known as GCSF is lenograstim. It attaches itself to GCSF receptors on bone marrow derived stem cells. Lenograstim binds to this receptor to stimulate stem cell proliferation and differentiation into neutrophil precursor, which eventually turn into active neutrophils, a subset of WBC that fight infections. This not only boosts neutrophil counts but also improves their mobility to infection sites and their capacity to ingest pathogens. Furthermore, lenograstim facilitates the mobilization of bone marrow stem cells into the bloodstream, which is beneficial for obtaining stem cells for transplantation. It helps to release mature neutrophils into the blood cells, shorten the duration of neutropenia, and reduces the risk of infection in patients receiving medication that inhibit the generation of WBC. Leograstism is mainly used to fasten the recovery of neutrophils in patients receiving bone marrow transplantation or chemotherapy. It has certain potential negative effects, but it also has some positive ones, such as lowering the frequency and severity of infection, minimizing hospital stay, and increasing the production of PBCs. For transplant procedure, bone pain is the most frequent adverse effect, affecting 13% to 71.2% of individuals. Other often mentioned side symptoms are nausea, exhaustion, headache, and insomnia. Fever 5.4% and enlarged spleen 4.3% are less frequent adverse effects. In rare cases, people with COPD may have major adverse effects like temporary ischemia episodes, autoimmune reaction, or secondary polyglobulia. Lenograstim is classified as highly specialized drug under Australia's Pharmaceutical Benefits Scheme with oversight from Commonwealth Department of Human Services. This classification allows for government subsidies enhancing patient access to this expensive medication, which is essential for treating complex conditions like stem cell transplantation and chemotherapy-induced neutropenia. Prescribing lenograstim requires authority permissions for doses that exceed maximum levels or are administered repeatedly. Additionally, healthcare providers may need to complete specialized training and prescriptions typically involve specialists such as oncologists, hematologists, and bone marrow transplant experts. Firstly, patients should know the purpose of the medicine, why they need to take it. They should be explained how to properly administer the medication and inform patient about the common side effects like bone pain and also how to manage them. We should ensure that they know when to seek medical help for severe reaction. Tell them the importance of regular blood tests and checkups to monitor their progress. Also encourage a healthy lifestyle with a balanced diet and gentle exercise. Offer information and support groups and always invite patients to ask questions or share any concern they may have.